Protecting a vulnerable population from influenza. This is a project that will be done in collaboration of two DNP students from Jacksonville State University. My name is Tamika Hines. I will be presenting the presentation in collaboration with HinesAndBrazile. This is a DNP guided primary prevention flu vaccination program. Our objective of today's program will be to clearly define what is influenza, to identify multiple types of influenza, our high-risk group, and discuss the primary prevention school-based influenza intervention program. We will also look at the leadership competencies for the advanced practice registered nurse in developing and implementing the program. In our introduction, we wanted to outline what is influenza. Most people will know influenza to be called the flu, which is a highly contagious respiratory condition. This condition can present itself as a mild flu-like illness, which can quickly manifest and change to a severe respiratory condition that could ultimately lead to respiratory failure and death. There are many different types of influenza, both that impact humans and animals alike. An estimated of 3 to 5 million cases of severe influenza will occur worldwide each year, resulting in about 250,000 to 500,000 deaths. Currently, influenza results in 50,000 deaths in the United States annually alone. So influenza can be very deadly. There's a segment of our population that is at an extreme high risk for influenza complications. Those are our elderly population, our pregnant women, individuals with other comorbidities or co-health conditions, young children, and children with neurologic conditions. Our program today will focus on looking at our children within our population and what does a complication of the flu can do for that segment group, that group of the population. We know our children, there can be dehydration, worsening of long-term medical problems, brain dysfunction, sinus problems, ear infections, and in rare cases, flu complications can lead to death. Therefore, it leads us to want to develop a interdisciplinary prevention program that will involve both all of the preventive measures, such as primary prevention, secondary, and tertiary prevention. But for today's program, we will focus more on primary prevention. The force behind the development of this program is based on other influenza program studies that have been conducted around the country. We understood that in order to improve adolescent vaccination, it would be important for us to host clinics within the school setting. The program may potentially reduce emergency care visits for influenza-like illnesses, as well as decreasing the risk within the community and improving school attendance. There is proof in completing these types of vaccinations. Studies have been shown, and a recent study showed that after administering vaccinations within a school-based clinic, that there was a sharp decrease in the population of by 46% related to the vaccination administration clinics that were conducted within a school. Intervention programs and vaccination programs as interventions do not prevent individuals from contracting the flu. However, it is known that people who will get the flu after being vaccinated have less serious cases than those individuals that are not vaccinated. Also, influenza vaccines only prevent influenza. They do not prevent any other respiratory viruses, and they do not cause the flu. How does the flu vaccination work? Flu vaccines cause antibodies to develop within the body after 2 weeks of vaccination. These antibodies will protect against infections and viruses that are used to make the vaccine. It is important to note that the seasonal vaccine protects against the viruses that was most common in the community the prior flu season. Therefore, individuals may be required or asked to take a second vaccination if the vaccine has been deemed ineffective for that flu season. Most flu vaccines have the capability to protect against 4 viruses. There are some that will protect against 3. However, However, there is a vaccine that has been specifically designed for our most vulnerable population, which are our elderly. The CDC frequently monitors and surveillance influenza cases throughout our country. And in this chart and in this report, the CDC is describing the number of patients that were enrolled in a U.S. flu vaccine effective network. This network results are yielded from year 2018, 2019, and it lists those individuals and age groups that received vaccination, those that did not receive vaccination, those with positive flu cases, and those that had negative, that were negative influenza cases. In our school-based program, we will outline the timeline for our the implementation of our program. In the month of August, school nurses will be trained on the influenza by the health department and the Children's of Alabama. In this training, nurses will learn how to disseminate information, what to look for, signs and symptoms of influenza in their students, and also how to put on an effective prevention program. Also, school nurses will disseminate influenza information to parents, as well as obtaining consents for students to participate in school-based health clinics that have the capability to administer vaccines and other immunizations throughout the year. In the month of September, school consents for participation in the influenza program will be disseminated, as well as nursing staff will assist in community meetings and PTA and PTO meetings at the schools. In the month of October, this school will perform announcements and letters prior to the influenza program. In the late October, influenza clinics will be hosted in 42 schools in the school district. It is important to note that clinics will be repeated in the spring if there is a greater than 15% of school population impacted by influenza. This slide, we wanted to highlight how primary intervention is done through education. This is just one of many educational tools that we utilize to inform our students, our staff, and our parents. The CDC frequently releases flu surveillance information. As we can see right now, we are looking at regional numbers for this for the state of Alabama currently, and the numbers in our school district are relatively low at this point. What is the role of the DNP in the primary prevention plan? Well, the DNP nurse serves as the program coordinator and administrator, as well as the lead health officer for the school district. The DNP nurse also coordinates with community partners in developing and presenting evidence-based teaching programs, serves as a program leader for hand washing, and for scheduling of vaccination clinics. The DNP also serves to assist in the tracking and monitoring of and surveillance of influenza within the district, as well as correlating and communicating with the local health department to give them that information. If there is high numbers that present to us, then we activate our district-wide support services when flu outbreaks are suspected. There were 4 leadership competencies that were performed during the implementation of this program, this annual program. Those were project management, relationship, communication, and employee development. It was essential for the DNP nurse to work with a collaborative and coordinated team to be able to address the students' overall health needs. This table here is a table of information that is routinely gathered by the DNP to evaluate the effectiveness of the school-based influenza program. This information is often referred to and constantly communicated with our local health department. If at any time any school has more than 2 cases of students with influenza, that information is therefore reported to our local health department. In summary, the flu is very common and also oftentimes mistaken as the common cold. However, the flu symptoms can lead to very serious illness, even up to death. Fortunately for us, most kids who get the flu will not have major problems, uh, but children are at a higher risk than others when they have other health disparities are involved. School-based immunization influenza programs have been shown to decrease the incidence of flu in the schools, therefore decreasing the number of flu cases within the community, decreasing of emergency room visits, thereby increasing student attendance. School vaccinations may be repeated during the spring if there are high numbers or a major flu outbreak. Our last slide will list our references that was used in the formulating of this program. Thank you for listening and watching.